Hello, welcome to Bridge to Safety, Module 4, Understanding Disability, Empowering Equity and Inclusion. The Bridge to Safety collaboration is a collaboration between ABLE South Carolina, Pathways to Healing, and YWCA of the Upper Lowlands. This project is funded through the United States Justice Office on Violence Against Women, and it works to create permanent changes within all three organizations that result in accessible, safe, and effective services for people with disabilities who have been impacted by interpersonal violence. Together, representatives from all three organizations share their expertise and knowledge with each other to build capacity and within each organization. And on the screen, we have the Bridge to Safety logo. It is a gray picture of the state of South Carolina. And in the middle of the picture of the state, in white lettering, it says Bridge to Safety. And then there is a picture of a bridge in blue outlined in white. The Bridge to Safety collaboration organizations are ABLE South Carolina. Our logo is written in black, saying the words ABLE South Carolina. Then we have the Pathways to Healing logo that in light blue says Pathways. In dark blue, it says To Healing. And it says underneath that in light blue, Advocate, Educate, Support. And then they have a light blue and dark blue heart. Then we have in orange the YWCA of the Upper Lowlands logo, which says an orange box with black lettering that says Eliminating Racism, Empowering Women, YWCA of the Upper Lowlands. We are so happy to have you joining us for this module today. We are going to focus on the following areas during the module: understanding disability and how that applies to your everyday work, disability types, disability in the United States and South Carolina, respectful language, barriers for people with disability in obtaining community services, and inclusion. And on the screen, we have a picture of an individual in a wheelchair, and it's actually the symbol of disability currently. It is in black. And then we have the words areas of focus with the orange line underlining the title. So we're going to talk first about understanding disability. We thought it would be really cool to talk about people with disabilities that you and I might know. So some people with disabilities that you might have heard of or know might be Billie Eilish. Billie Eilish is a singer with Tourette syndrome. In the picture, she has yellow and green and brown hair. She is wearing silver necklaces, a black t-shirt with green waves and flames, and she's holding a microphone. In the upper picture, we have Michael Johnson sitting in his wheelchair in his race car driving suit with his red, white, and blue race car with an American flag on the back. Cara Delevingne, she's an actress and model. She has both ADHD and dyspraxia. Johnny Depp, who many people may know as an actor, he identifies as being visually impaired. You have Peter Dinklage, an actor. He has achondroplasia, dwarfism. Some of you may know Millie Bobby Brown from Stranger Things. She's an actress who identifies as being hearing impaired. Demi Lovato, the singer and actress, she identifies as being an individual with a psychiatric disability. She also uses pronouns she and they. Michael Johnson is a race car driver, as I mentioned earlier. He has a physical disability. And Simone Biles, the Olympic gymnast, identifies as being a person with ADHD or attention deficit hyperactivity disorder. Although people with disabilities sometimes refers to a single population, this is a diverse group of people with a wide range of needs. Two people with the same type of disability can be affected in very different ways. Some disabilities may be hidden or visible, while others may not be easy to see or be invisible. In this case, I represent both types of disabilities. I have a physical disability and I use a power wheelchair and a service dog, so a lot of people can tell that I have a disability. And I also have a hidden disability. I have a developmental disability, which means that I process information in a non-traditional way, and that is a disability that people can't see, so it would be invisible. We want to think and guide our conversation today on whose input is valued most. When we're working with people with disabilities or disabled individuals, are we valuing the community's input or the service provider solely? Are we looking at the person's doctor or medical team? Are we getting input from their family? Or are we going directly to the person with the disability for their input on how they would like to receive services? And really thinking about whose input should be valued the most? The person with the disability or disabled individual, or the other supporting people in their life? It should be the person with the disability. They're the ones who know the best information about themselves. They live their disability 24 hours a day, 7 days a week, 365 days a year. They know what works best for them. They know the right supports or accommodations they need, and they can explain to you how their disability impacts them on an everyday basis to best help you provide services to them. We're going to talk next. Now that we know a little bit more about disability, we're going to talk about the Americans with Disabilities Act and how the ADA defines disability in the course of our work serving people with disabilities that are impacted by violence, assault, crime. The Americans with Disabilities Act is a civil rights law that was passed on July 26, 1990. It is divided into 5 titles. Title I is employment. Title II is public service, state and local government agencies. Title III is public accommodations, and these would be the places that we all go every day in the community. Doctor's offices, restaurants. Some of us go to movie theaters. Some of us go to shopping avenues. So wherever you go, it's the places that we use every day in our lives to meet our everyday needs. They have to be accessible as well. And then we have Title IV, telecommunications, which ensures that communication is effective for people with hearing disabilities. It can be what we call sign language interpreters on emergency response. It can be closed captioning on the bottom of a television screen that allows an individual to have access to what's being explained on the screen. Title V is miscellaneous, and miscellaneous allows an individual with a disability to express concern if they're being discriminated against and be protected from retaliation or coercion. The Department of Justice, or the DOJ, oversees the Americans with Disabilities Act. In the picture on the screen, it is a black and white photo of President George Bush signing the Americans with Disabilities Act into law on July 26, 1990. And in the picture is President Bush, some senators and other leaders, as well as an individual with a disability that helped create the Americans with Disabilities Act. So let's look at what is disability according to the ADA, or Americans with Disabilities Act. Disability is defined as a substantial limitation in being able to perform one or more major life activities. Some of these activities can include reading, writing, communication, transportation, thinking and processing information. These are all things that we do every day. People with disabilities, even though they may have a limitation in performing these major life activities, it doesn't mean they don't do those activities. It means that people with disabilities or disabled individuals complete tasks the non-traditional way. For example, in my own life, I take a shower using a shower bench. I use a power wheelchair to navigate and get around the community. I use a service animal to help me pick up items, to help me open and close doors, to help me get things out of cupboards and drawers. I use voice to text software to help me write and type information. So people with disabilities can complete tasks that all individuals do. They just use non-traditional methods to complete those tasks. And on the screen now, we have an individual who is in a wheelchair wearing a bathing suit at the beach. And it illustrates some of what we were just talking about, some of those activities of daily living: working, walking, talking, seeing, hearing, caring for oneself, going to recreation like the beach, things that we all do in our everyday lives. We may have a limitation in being able to perform those activities, but we find non-traditional methods to carry them out. There are many types of disabilities that can affect a person's activities of daily living: vision, movement, thinking, remembering information, learning information, communicating, hearing, mental health, and social relationships. These are all things we want to think about when we're delivering services to individuals. We want to make sure that we're keeping these in mind and asking individuals with disabilities what would be the best accommodations and supports to help them carry out these activities of daily living when they're receiving our services. So we've been talking about the definition of disability. Let's explore some specific types of disabilities. And on the screen, we have a picture of an individual in a wheelchair who is also carrying a cane, and he's walking alongside his daughter, who is a non-disabled person, and she's wearing jeans and sneakers, and he's got jeans and a shirt on and sandals. Some specific disabilities include cognitive disabilities, head injuries, brain injuries, Parkinson's disease, any disability that impacts the brain and how we think and process information. We have physical and mobility disabilities. These are usually disabilities where an individual may use a wheelchair, whether it's manual or power wheelchair, a scooter, a walker, canes, a rollator, which is a walker with wheels and a seat, to navigate and get around the community. Some disabilities under the physical category and mobility category can include muscular dystrophy, multiple sclerosis, and other disabilities like that. Speech and communication disabilities impact the way people communicate and share information. They may use non-traditional modes of communication like augmentative communication devices, communication boards, sign language, apps on their phone or tablet, which will have a simulated voice, which will share with you what they're trying to let you know. Some disabilities in this category can include aphasia, can include Alzheimer's and Parkinson's disease, cerebral palsy, and even some people who utilize sign language and can use some speech that have hearing disabilities. Learning disabilities basically mean that individuals with disabilities learn in a non-traditional way. Some of these disabilities include dyscalculia, dysgraphia, dyslexia. People may see words and numbers and letters in reverse order. Psychiatric disabilities include a wide variety of disabilities. It can be anxiety disorders, mood disorders. Some people may have what we call major depressive disorder, bipolar disorder, or schizophrenia. This disability has the largest type of stigma attached to it, and we as a community can work to dispel those stigmas and stereotypes. Hearing disabilities fall into two categories. We have people who are known as hard of hearing, which means they hear certain sounds, but they can't hear a lot of different noises like you and I can to filter it out. They may use hearing aids, they may use cochlear implants, and then you have people that are completely deaf and can't hear anything. They may use sign language or read lips to communicate or write information down. We have people with visual disabilities, and these folks may be people who have low vision, which means they usually need things enlarged, or they may use a magnifier. We have other people who are what we call legally blind, which means they can only see lights and shadows. And then you have people that are completely blind. From there, we're going to talk about intellectual and developmental disabilities. And that just means that people process information in the non-traditional way. Health disabilities can be disabilities like COVID, other respiratory disabilities that may impact an individual. And then we have temporary disabilities, and these are individuals who may have had a surgery, may have broken an arm or a leg. They are covered under the Americans with Disabilities Act and can receive accommodations until they don't need them anymore, or they start to get better from an operation, or they heal after breaking an arm or a leg. According to the Centers for Disease Control and Prevention, 61 million Americans have a disability in the United States. 26% of Americans have a significant disability, which means that they have a limitation in being able to perform one or more major life activities and utilize a reasonable accommodation or support to accomplish those daily tasks, as we mentioned before. When we break down those statistics, 1 in 4 Americans has a disability currently in the United States, and 1 in 3 South Carolinians has one or more disabilities. That means in South Carolina, we are higher than the national average. That means, think about if that was you. Disability doesn't change who you are at the core of who you are. And it means that each of us are going to come into contact with people in our lives that may have disabilities. It may be the people we serve in our jobs. It may be our friends or family. It may be someone we go to church with. No matter how disability impacts us, at the end of the day, disability is an important component of an individual, but it doesn't stop us from wanting to live life just as everyone else does. And in the picture, we have a gentleman looking out at the mountains. He has an invisible disability, and there are mountains and trees, and he has his hands on a metal railing as he's looking out at the mountains and the water. So now that we know how many people are impacted by disability, let's look at the similarities between those with disabilities and those without. They both desire independence. We all want to find the way that works best for us to complete tasks and live everyday life. We want to be included with friends and be in programs with everybody in the community. We all have talents and skills and abilities. And each of us is unique in our own way, whether we have a disability or whether we don't. All people with disabilities are not the same. People with disabilities, even if they have the same disability, they use different reasonable accommodations or supports to do tasks in their everyday life. People have different communication styles. Some people are introverted, some people are extroverted, some people like to use texting, some people like to use their voice to communicate. Other people may use sign language, a communication board, a communication app, or a augmentative communication device, which is like a small laptop computer. They press a button or a picture and a simulated voice will speak for them. Some of us want to be out doing a lot of activities while some of us want to stay home, and that's okay. Each of us has a unique personality that all of us can appreciate. And lastly, each of us does tasks, including people with disabilities, in our own way that works best for us. Now that we've talked about differences and similarities in people with disabilities and in people with disabilities and without disabilities, we're going to talk about language and identity. Here are some language you want to avoid: cripple, suffering from, wheelchair bound, handicap, special or special needs. People in the disability community don't enjoy the word special or special needs. That word or words was created by the education community. People with disabilities aren't any different than people without disabilities. We have the same needs to be accepted, to have friends and social opportunities and community, and to work. Special needs implies that our needs are not the same as people without disability, or that our needs are more important than people without disabilities. So it's more preferred to say individual with a disability or disabled individual or person. The R word, and I'm going to use it just for the purpose of this module. We would not say this word in our communities. It's outdated and not correct. The R word is referring to calling people retarded. We now say individuals with intellectual disabilities. Person first language is talking about the person and not the disability. Remember that disability is just one part of a person. Some examples of where you would use person first language include person with an intellectual disability, person with a physical disability, wheelchair user, accessible parking space, person without a disability. Identity first language is a wonderful tool used by people with disabilities to reclaim pride in disability. Because oftentimes people view disability as an ugly term, an ugly word, and it is not. Disability and the disability culture is rich and vibrant, and having a disability for a lot of us, including myself, is something we are very prideful about. It has made us who we are in terms of feeling comfortable, achieving things in our lives, being able to express ourselves and communicate in the ways that work best for us. So we want to encourage people to recognize that disability language is very diverse, and identity first language is positioning disability as an identity category. It's known as identity first because the identifying word comes first in the sentence and highlights the person's embrace of their identity. Examples include disabled, autistic. In my own life, I will say developmentally disabled woman, physically disabled woman, because I'm proud to be a member of the disability community, as are many individuals with disabilities. So it is really important when we look at language to examine different facets and when to use them. And what do I mean by that? Examining different facets and when to use which type of language. It's individual preference. People with disabilities are all different, even if we have the same disability, and we each may want to be referred to in a specific way. So when in doubt, ask the person's preference. Ask them, would you prefer for me to correspond with you or talk about you or write reports where you're included using person first language or identity first language? We should always ask the person what works for them, what they would prefer, and then we should always remember to ask each individual and not assume who has disabilities and who doesn't. It should become a part of our everyday work. What language would you prefer? Because not everyone's disability is easily seen. So keeping in mind language and disability culture and disability vibrancy, we're going to talk about intersectionality. Intersectionality includes protected characteristics that include social class, ethnicity, sexual orientation, race, religion, disability, and gender. It's the idea that these layers do not exist separately from each other, but rather they intersect to form a person's identity and can magnify the discrimination and marginalization they might experience. To fully understand to what extent it's crucial to look at the whole picture of someone's identity. Here's what our staff member, Wednesday Jones, has to say about this topic. Intersectionality is how different types of discrimination overlap. Things like race, gender, disability, and sexuality are connected. You can be discriminated against for any one of these things or more than one of these things at the same time. Let's explore intersectionality and disability with a couple of more examples. For example, Eve, a Black wheelchair user who is also a lesbian, transgender, and Muslim, will have a different lived experience to Sarah, who is a white heterosexual woman who uses a wheelchair. There's every possibility that Eve will have to navigate misogyny, racism, Islamophobia, homophobia, and ableism on any given day. And we have a picture of two individuals in wheelchairs. One is lesbian, transgender, and Muslim, and Sarah is in the blue and red wheelchair, is white, heterosexual, a woman who uses a wheelchair. Well, now that we've heard a little bit about intersectionality and disability, let's explore some myths or misconceptions around disability, and we're just going to talk about some. Some myths around people with disabilities include people with disabilities should not and cannot live independently. People with disabilities cannot have relationships or families. People with disabilities are asexual and don't want romantic relationships. People with disabilities don't want to work or be employed in integrated settings. And we should set lower expectations for people with disabilities. All of these are myths, and individuals with disabilities should be held to the same standards and have high expectations for, can be in relationships, they can work in integrated settings, they can have families, and they should be allowed to make choices for their own lives, how they want to live their lives. So thinking about some of those myths and misconceptions, they can lead to barriers for people with disabilities in our communities around South Carolina. So what are barriers for people with disabilities? Barriers for people with disabilities include factors in a person's environment through their absence or presence that limit functioning and create disability. Some barriers for the disability community can include a physical environment that is not accessible, limited or no access to assistive technology, assistive, adaptive, and rehabilitative devices, lower expectations or negative attitudes of people towards disability, services, systems, and policies that are either non-existent or that hinder the involvement of all people with a health condition in all areas of life. Some of those attitudinal barriers, including stereotyping. It's when people sometimes stereotype people with disabilities, assuming their quality of life is less or that they are unhealthy because of their impairments. It can include stigma, prejudice, and discrimination within society. These attitudes may come from people's ideas related to disability. So sometimes we have internal bias, sometimes we have internal ableism. And that's where people see disability as a personal tragedy, something that needs to be cured or prevented, a punishment for wrongdoing, or even as an indication of the lack of ability to behave as expected in society. A lot of us have heard this quote, "The only disability in life is a bad attitude." And that's not true. Not having a ramp, not having a curb cut, not having braille signage is not a bad attitude. It's a lack of accessibility. And so sometimes we can have barriers that are attitudinal when we believe that people with disabilities shouldn't be allowed to do certain things or are less than, and we may not even realize we are doing that or having those biases. And as we've talked about in a previous module, ableism is discrimination or prejudice against people with and or people who are seen to be disabled, when you presume a person is less than because of their disability. Some examples of ableist beliefs. We should feel sorry for people with disabilities. People with disabilities, they have a lower quality of life. Individuals without visible disabilities are faking it and should try harder. If we prefer to hang out with individuals without disabilities rather than people with disabilities or disabled people, that can be an example of ableism. People with disabilities shouldn't have children, or only people with certain disabilities should be allowed. Those are all examples of ableism and ableist beliefs. There's another kind of ableism, and it's called benevolent ableism. And it's when someone thinks they are helping a person with a disability, but by treating them differently, their actions are hurtful or harmful. In doing so, they contribute to stigmas that people with disabilities aren't as able as everyone else. So when we say things like caring for instead of supporting the individual, when we're making ourselves the predominant person that is helping them instead of saying we're facilitating them to reach their goals of receiving services, etc. So how do we avoid ableism? Here are some great strategies. Allow people with disabilities to make decisions about their lives. Encourage individuals with disabilities to develop and use their independent living skills. Assist people with disabilities in taking part in integrated community activities and services that we provide to all people. Having high expectations for people with disabilities, and give individuals the opportunity to try something new. Don't assume they can't do something. Just because they don't do it the traditional way doesn't mean they shouldn't get the opportunity to participate. Ableism has led to another example of an attitudinal barrier. We call it inspiration porn. Inspiration porn is when people with disabilities are portrayed as inspirational solely or in part based on their disability and not what they have accomplished. It's where we produce and put out and share images, videos, and memes of disabled people using to motivate non-disabled people, suggesting that if a disabled person can accomplish something, then surely a person without a disability can. Typically, the person with a disability is doing a normal activity like walking, eating, writing, etc. In my own life, I've had individuals without disabilities say to me, well, if you could go to college, obviously I can. Those are examples of ableism and inspirational porn ideas. Inspiration porn examples look like these two memes that people often share on social media. They show a child with a disability who may be using prosthetic devices, and it says, "Your excuse is invalid." Or another meme where a little girl is drawing on a piece of paper. She's wearing a hot pink dress, pink barrette in her hair, and it says, "Before you quit, try." And because she doesn't have hands, that is supposed to inspire other people to not quit. That's exploiting people with disabilities to make non-disabled people feel comfortable, relaxed, and as though they are better off than people with disabilities. So there are some communication barriers for people with visual disabilities. When we put out brochures, handouts, that small print, or we don't offer large print versions, when there's no Braille or electronic versions for people who use screen readers, that can be a communication barrier for people with visual disabilities. Communication barriers for people with hearing disabilities can include videos that do not include captioning or oral communication without accompanying manual interpretation, such as American Sign Language. Communication barriers for people with intellectual or processing disabilities. When we use technical jargon, long, complex sentences, and difficult words, when we don't use pictures or diagrams to outline information, and when we don't explain our expectations and we assume that everybody understands without asking for clarification. Physical barriers can look like steps and curbs that keep people from entering a building or being able to go on the sidewalk, lack of accessible parking, no Braille signage, having door knobs instead of lever handles, stairs and no elevators, narrow access aisles, high front desks where people can't see the person at the front desk or they can't fill out information, and where we have podiums for conferences or presentations and they're high podiums and the person with the disability can't be seen from the podium. Policy or programmatic barriers can include criteria for programs that exclude individuals with disabilities, requiring a high school diploma or driver's license, not allowing service animals or personal care attendants, evaluations that measure success on non-disabled norms, or things like requiring people that they have to give eye contact when for certain individuals with disabilities like autism, eye contact can be a very painful thing. Program materials not in plain language or alternative formats. Denying reasonable accommodations to qualified individuals with disabilities so they can perform the essential job functions. Transportation barriers for people with disabilities include a lack of access to accessible or convenient transportation for people who can't drive because of vision or cognitive disabilities. Public transportation may be unavailable or at inconvenient distances or locations. This is a picture of someone trying to navigate the barriers or the maze of trying to get public transportation. It's an individual who is a cartoon figure trying to navigate a maze and not have access to transportation. Some media barriers can include: look at the social media and stories you may share within your organization of success. You want to ask yourself the following questions. Is it from the perspective of a person with a disability? Does it emphasize similarities? Does it normalize disability? Does it promote inclusion? Does it break down stereotypes? What is bad media? That would be referring to the things we mentioned earlier around ableism and inspiration porn, or feeling sorry for people with disabilities. We want to stay away from media that emphasizes those things. So we've talked about the barriers that can exist for people with disabilities in accessing services. We're now going to share how we can break down those barriers. Unlocking barriers includes getting fair treatment from others, so people with disabilities not being discriminated against for accessing the services that everyone else has the opportunities to use. Making products, communication, and the physical environment usable by as many people as possible. This is also called universal design. So while you may have a ramp outside of your office, while an individual who uses a mobility device can use it, so can a mom who's using a stroller to help her child to get in the building. It's universal. Anyone can use it. Modifying items, procedures, or systems to allow a person with a disability to use them to maximize extent possible. So giving people the opportunity to use reasonable accommodations or reasonable modifications to your policies, as the ADA and the Rehabilitation Act of 1973 suggest. Eliminating the belief that people with disabilities are unhealthy or less capable of doing things. So eradicating stigma and stereotypes. When working with people with disabilities, we can all empower individuals. So number one, check yourself for any outdated ways of thinking about disabilities. Practice different styles of support to see what works best for that individual. Learn when and how to respectfully take a step back to promote independence. Be an ally for the individual to be shown respect, given choice, and have the same opportunities as those without disabilities. Expectations and respect. There is a tendency to have lowered expectations of persons with disabilities. Lower expectations limit opportunities to try new things and interfere with growth. Focus more on what a person can do rather than what they can't do. Show respect to the person you're working with. Respect can look like asking for permission before you help or touch your consumer or client. Avoid talking to others about something personal or embarrassing for the client or consumer you're working with. When out in the community, encourage the consumer to speak up for themselves and letting the consumer or client make their own decisions, even if you don't agree with their decisions. What is disability inclusion? It's including people with disabilities in everyday activities and encouraging them to have roles like their peers without disabilities have. Everybody has the opportunity to explore all of the services your organization offers, and everybody has the opportunity to have the roles in those organizations of leadership and peer support, that whether you're a person with a disability or a person without. More than simply encouraging people, it requires making sure that adequate policies and practices are in effect in a community or organization. And we have a picture of a dad who is a wheelchair user and all of his children hugging him, starting from the top of his body all the way down to his footrest. What gets in the way sometimes of us providing services to individuals with disabilities? Our expectations of what they can do and what they're capable of doing. What we believe people can achieve. The choices we may envision for them. Our fears, our concerns. Sometimes overprotective environments and not allowing individuals to try activities, to try experiences with other individuals. Worrying that people may fail, protecting them. People with disabilities have the right to fail just as anyone does. That's how we learn, strategize, problem solve, and cope. And ignoring self-determination skills as things that need to be taught and practiced. What can be done? Challenge your expectations. Nothing will change if you don't believe that all people, regardless of disability, can participate. Pay attention to the environment, the accessibility. Is it equitable? And are you providing opportunities for people to engage that include people with and without disabilities? Some best practices as you're providing services to people with disabilities are: treat the individual you are working with like an adult. Get to know the individual you are working with. Encourage them to participate in the community activities for everyone that you offer. Give people with disabilities options and let them choose what they want to do. Allow opportunities for people to be more independent. Provide supports to meet individual needs. Remember that people with disabilities have the right to fail just like anyone else. Alex is an individual with a spinal cord injury, and Alex wanted us to share: an individual is more than their disabilities. Service providers and the general public must value everyone equally and realize that each person can make a positive impact on society. Meet Carrie. Carrie is getting her master's degree in social work and uses a personal care attendant, PCA, for school and to live independently. Carrie believes everyone should be able to have professional and community opportunities, no matter what accommodations or supports they need to succeed. I'm excited to announce that Carrie just graduated with her master's degree in social work, and Carrie is a person with multiple disabilities, both developmental, physical, and Carrie is using her power wheelchair in this picture in a gray dress with a purple, blue, and green scarf. And she has long brown hair and glasses, and she's out in the community. As we're closing the module today, we want to remind all of us that shifting the culture takes work. Disability is part of being human. When people with disabilities are segregated or left out of parts of the community's culture, they seem different, and that perception sticks. Here are some final thoughts. Disability is not a brave struggle or courage in the face of adversity. Disability is an art, and it's an ingenious way to live. And this comes from Neil Marcus, a famous artist with a disability who uses a paintbrush in his mouth to paint. We want to share this disclaimer. This project was supported by grant number 2017 FWAXK001, awarded by the Office on Violence Against Women, U.S. Department of Justice. The opinions, findings, conclusions, and recommendations expressed in this publication, program, and exhibition are those of the authors and do not necessarily reflect the views of the Department of Justice, Office on Violence Against Women. Thank you for joining us today. We want to share some other resources. The World Health Organization's International Classification of Functioning Disability and Health. The annual report on people with disabilities in America from the University of New Hampshire Institute on Disability, the Centers for Disease Control and Prevention, National Center on Birth Defects and Developmental Disabilities Division of Human Development and Disability and Health Data Systems.